Good morning, everyone. And my name is still Akimi Bikunle Tijani, the Director of the Center of Excellence in Migration and Global Studies. And then we welcome you to the first quarter, the first presentation in the first quarter of 2021. We appreciate your participation. We appreciate the fact that you find the time to join us every time, all the time. Today's presentation is from one of our colleagues. I'm saying one, there are two presenters. And of course, the second person is in Syracuse University, who unavoidably will not be able to join us because of the 7 hours time difference. It's so tight. So we can appreciate those who were constantly with us throughout last year. And I will introduce the person shortly. We use this opportunity to congratulate ourselves on the maiden edition of the Center's Journal, a peer review. And indeed, you do not have to pay to publish because it's your intellectual property. And then we have gotten funds to continue to publish, at least, maybe as soon as I end my tenure in another. I'm not going to be counting, so, and talking about counting, let us appreciate the visionary and the founder of the Center of Excellence, the person that has the wherewithal to put that fund from TED fund somewhere else, but chose to establish this and then create an environment for all of us to share intellectual property and develop ourselves beyond Abuja, throughout Nigeria, the United States, Europe, and Australia, and some other places. So we deeply appreciate him. He has completed his tenure, and he has left, but he's still with us. And I'm sure he will join us. I've been looking, he's going to join us very soon. I have apologies from the Vice Chancellor, the new Vice Chancellor, Professor Femi Peters. He was actually here virtually before most of you came in, and we chatted also on the phone. Unfortunately, he has to attend to the management meeting. The principal officers are meeting with him. And as you know, if you just take over, it's a serious business. You have to really understand, and at least a lot of meetings. So he may return and join us, but he just sent his apologies as well as that of the principal officers. They have been so supportive, extremely supportive of our activities. And the VC, Professor Peters, has given us that promise, which he fulfilled this morning, even yesterday and this morning. And we deeply appreciate that, sir. We understand that he's so busy. The next presentation is a roundtable. I believe it's next week. And he is going to chair that roundtable because it's about media discourse, social media discourse, in honor of immediate past Vice Chancellor Dalla Ubadamu, who created this center and what we all are benefiting from. Again, we've published the first journal, and please, manuscripts are welcomed. You send to our official email. Don't send to my email, please. Official email, please. Very, very important. So, having said that, let me present to you the presenter of today's paper. We have our colleague from University of Ilorin. The title of their presentation is Mandatory Quarantine: Risk, Challenges, and Experiences of Nigerians Evacuated from the United States. And as I stated before, Dr. Ruth Abiola Ademola is not just a senior lecturer at the Center for Peace Studies, or Peace and Strategic Studies, University of Ilorin. She's also a senior legal practitioner, and more importantly, in my opinion, the president of COSFAN. COSFAN is, I believe, it's Commonwealth. It's for those of us that had the Commonwealth Scholarship and Fellowship. Let me just put it that way, because I'm also a member and a fellow. Our co-presenter is a colleague in the Department of Public Health at Syracuse University, the Syracuse University in upstate New York. And they are speaking to us about quarantine, the race, and what have you. Let me use this opportunity to say that the COVID-19 or the pandemic is real. I hope I will not get labeled on main campus. And I know some people are laughing. Tijani is saying main campus again instead of headquarters. On main campus for enforcing, and even at model, enforcing, or wherever I go, enforcing the use of face masks. I'm not using it because I'm the only one where I'm broadcasting from. It is real, I must state, it is real. And I can tell you that despite my own personal precautions, you know, I caught it. Most people, it's good to share this personal experience, because until I told it to some of the junior staff, they started wearing it. You cannot overprotect yourself, but you must wear it. Particularly today is the law. You have to. And we thank God that we are still here. We did not degenerate into a very serious thing. So the topic is so germane and it's so relevant. And we will listen to Dr. Ademola, who is presenting on behalf of the two scholars. And you have 40 minutes, ma'am. And after 40 minutes, as usual in our tradition, you will, you know, I may give you an extension of 5 minutes because I could see your PowerPoint is 53. Also important, if you check your email, for those of you that are on our list email group, we have posted this PowerPoint, and then you can follow from there. So check your email, and then you'll see. Once again, I thank you for joining us for this maiden edition in 2021, and I, would like to say that the Vice Chancellor who was with us before send his sincere apologies. He has to meet with the principal officers, among others. Thank you. Dr. Ademola, you have this special virtual floor.
Thank you very much. Thank you very much, Professor Ibikunle, and good morning. Unfortunately, my colleague, Dr. Ignatius Ijere, will not be able to join us. We are sent.
I think we're having challenges. He just left. It happens.
As I said, the topic is mandatory quarantine, risk, challenges, and experiences of Nigerians evacuated from the United States. Thank you. Thank you very much. We are going to be discussing this morning on this topic, the introduction, statement of discussion of findings, and conclusion and recommendations. COVID-19, as we all know, belongs to the class of novel coronavirus severe acute respiratory syndrome, coronavirus SARS-CoV-2, and it has had and it is continuing to have severe negative impact on many people's lives globally. The virus has no limit to who to infect because it infects anybody. And even within the nation or the states, the percentage differs from one place to the other. We also know that the virus appears to run across people of different races, ethnicities, socioeconomic, and immigration, political affiliation. In some countries, they have been able to manage the virus effectively, whereas in others, it is spreading very high. Studies have shown that vulnerable persons can be infected with the virus when they contact virus contained benefits from human or animal. Recently invested. Still this year, with us, making the transmission possible. International migration and spread of disease. In France, there are more than 20 million travelers every year, 4.5 million of which are destined for areas at high risk for health. Because whether there is COVID-19 or not, people still move from one place to the other, and the international migration cannot be stopped. It continues from day to day. There are several modes of travel, as we know. Sometimes trips can be short, sometimes it can be extended. In previous years, we have seen the emergence of diseases imported by travelers in Europe, such as the NOUN in France and Italy, and also malaria in Greece. Also in Nigeria, Ebola was transmitted and brought to Nigeria by an acutely ill traveler from Liberia. There has been a lot of measures to curtail the spread of COVID-19 globally. And in order to contain the spread, many countries of the world, including the US and Nigeria, adopted lockdown and stay-at-home measures. In the Netherlands, as I talk to you, they have restrictions that are related to tiers. Tier 1 restrictions include 10 p.m. public curfew, while Tier 2 refers to an area being on high alert. For example, in restaurants. According to their county, was the spread of positive COVID-19 cases, which are increasing across the entire county. You must only meet indoors within or observe the rules of what and use face masks and all this. All these efforts are to contain the spread of the COVID-19. There are several ways that the spread of COVID-19 has been managed. Symptoms are relatively individualistic in their manifestations and duration. On the continuous transmission. For instance, in EU country, we use lockdown, quarantine, vaccine. Even in the United States of America now, they are also using vaccine, including Dubai and some other countries. Thus, the spread has been under control and manageable in such areas, in such states. The most effective technique is to use handheld sanitizer, as we all know. Wash your hands regularly, avoid interaction with face and mouth after contaminated areas, and so on. It is also very important that infected caregivers should use personal protective equipment. Use gloves, eye cover, gowns, and face masks to avoid the spread of the pathogen. However, in some countries, there has been a high COVID-19 infection and death, including the USA, but have faced restrictions on self and mandated isolation, including Nigerians who have traveled to the United States. We try to conceptualize the mandatory quarantine, and we give clarification to its meaning in this work. Quarantine, according to Mary Merriam-Webster Dictionary, quarantine is a condition, period of time or place in which a person, animal, plant, vehicle, or any such amount of material suspected of carrying an infectious agent is kept in confinement or isolated in an effort to prevent disease from spreading. And when you talk of mandatory, it's the result of a mandate and order. It has become a law. And so putting this together, mandatory quarantine is the government order or regulation of a period of 14 days isolation of persons arriving from abroad during the lockdown to prevent the spread of COVID-19 pandemic disease during the known incubation period of the virus. This 14 days is being used in Nigeria from other countries like Canada. Institutional quarantine in Nigeria. The government quarantine for all in Nigeria. And the mandatory quarantine for the post of all those members need to start this. And this has to do with the fact that such people that has been identified will stay in identified government facility for 14 days. And they are not expected to interact with their family members except with the surveillance officers that are fully dressed in personal protective equipment. And this has to be on routine monitoring. Why isolation, as we know, separates sick people with a contagious disease from people who are not sick. On the other hand, separates and restricts the movement of people. It has recommended that all people, whether or not they had had COVID-19, take steps to prevent getting and spreading the virus. And by NCDC regulation in Nigeria, all returning travelers to Nigeria and everyone who has been in close contact with a confirmed case of COVID-19 shall be institutionally quarantined for 14 days at their own cost in a facility identified by the government. And this is exactly what we have seen. What actually is happening in the quarantine facility for these people that are returning. This was what we examined. And effects of lockdown on travelers are many. Some sojourners became stranded in their countries of sojourn, including some Nigerians visiting the United States of America. They were stranded and they could not return to Nigeria as scheduled on their flight tickets. To ease the effect of the lockdown, what the Nigerian government did was to arrange for the evacuation of some Nigerians from the US to Nigeria. And such evacuees were to observe mandatory quarantine regulations for 14 days when they arrived in Nigeria. Statement of the problem. The issue is that the level of risk of vulnerability varies. For instance, in the US, people of color appear to be at higher risk of being infected than the white population. Other studies have identified chronological age as a moderating factor in times of susceptibility. Thus, individuals that are 50 years and above are more vulnerable. In fact, it accounted for 53.6%. Whereas people under 10 years accounted for, and also those that have underlying diseases appear to be at high risk of infection. Most pandemic threats are caused by viruses from either zoonotic sources or vector-borne sources. The objectives of this study are to investigate the risk of COVID-19 pandemic on some Nigerians evacuated from the United States, to examine the challenges occasioned by the lockdown and stay-at-home regulations against them, and to assess the experiences they went through. And during the qualitative design method. And both primary and secondary data were collected and utilized. We used key informant interview, and the instrument was used to gather data for the study through a direct online interaction with key informants to elicit deeper responses from them. It was a lockdown period, so nobody was expected to go out. So we had to use online to reach them through questionnaire and KII. But possibly choosing from evacuee from the USA during the COVID-19. It was 10 of the evacuees from the USA. The KI questions were administered online to 10 Nigerians stranded in the USA during COVID-19, and which were eventually evacuated from the New York to Abuja. They were lodged at the Royalton Hotel, Gongola Street, Area 2, Abuja, from 10th to 24th May 2020. The KI was divided into 5 sections. We have demographics, evacuation, impact of quarantine on travelers and their experiences. Also, we like to say that we obtained online consent from the respondents who willingly responded to the questionnaires online. We have our demographic data, and we can see that we have more males, and they are all Nigerians. They are highly educated. They are from different occupational areas. Their operational status varies. We saw that they are from different parts of Nigeria, Delta, Kano, Kwara State, and so on. We also try to find out some of the knowledge they have about COVID-19, and all of them have information about COVID-19 and how it spreads. We also have questions on how people can be infected, and 7 out of them, majority of them, are aware. We found out that majority of them also know about the risk factor associated with this COVID-19. We tried to also find out what their mission was in the United States. Some of them went for business, some for conference, some for family visits, and so on. They got to know about the government of Nigeria's information on evacuation in the United States. And some had online, social media, television, news, and so on. We asked them about the airline that flew them back to Nigeria, and it's clear that it was Ethiopia Airlines, because 9 out of 10 said it was Ethiopia, and the other one was undecided. And we found out whether the flight ticket was free because they were not able to use the original flight tickets they bought for their return. This one that the government has provided, was it free for them? But we discovered that it was not free. And the amount paid by each $790 and $2,000 for a return ticket back to Nigeria, which they bought the cost by themselves. And we try also to find out from them whether when they were in the hotel, whether the cost of the hotel was free, but majority of them made us to know that it was not free. They had to pay. The duration of staying was an average of 15 days. Some says 14, some said 15, some said 16, but majority said 14 days. We found out about their feeding. Some of them said it was free, others said they were paying, but majority was of the opinion that the food was free. And we found out also the rate of the meal for those that said it was not free, and it was between 1,200 to 3,600 naira per meal. And they also responded to let us know that the COVID-19 quarantine have negative impact on them as travelers. And the negative impact includes psychosocial trauma, effect on economic livelihood, supply of necessities to them. It has impact on their management, even in the hotel. And it had negative impact on them. The provisions that they expected at the accommodation were not there. So they also responded that setting up of isolation centers for suspected COVID-19 patients who are travelers was adequate. Some said it was not adequate. Some said it was fair. But majority of them said it was not adequate. And also, we wanted to know the extent of adequacy of provision of hygiene material. And majority of them said it was adequate. Provision of testing kits. Of them said it was adequate. Others are of different opinion. Enforcement of wearing of face masks, majority said it was implemented. Count on treatment and care of infected travelers. 3 of them said it was adequate. Others had different opinions. And for this one, the 3 said it was adequate, 3 said it was not adequate, 3 said no measure was taken at all. 1 said it was very inadequate. It was very adequate. So they had different opinions. And we also have information on dissemination of necessary information to them, but they had various responses. So discussion of results. 8 males and 2 females were there, meaning that we have more males than females. Majority, 4 of them, aged between 51 to 60 years old. All respondents were from Nigeria, were Nigerians. Majority are PhD holders, meaning that they are all well educated. They are of different professions and businesses, as we have earlier seen. All the respondents have heard of COVID-19 before. They have basic knowledge of what the disease is all about. Also, all the respondents indicated to know the risk factors in the spread of the virus. Majority, at least 7 respondents, were of the opinion that travelers are predisposed to COVID-19 infection. Impacts of quarantine on travelers. Results showed that 9 out of 10 respondents live in Nigeria. Only 1 lives in the United States. Majority of them were in the US for family visits, while others went for businesses, conference, and training. In addition, respondents had different experiences in the US during the lockdown, and information of evacuation to Nigeria were mainly through friends and the media. Impact of quarantine. Majority of them were through the embassy was by at first got proud to the COVID-19 back to Nigeria. During the evacuation process in the United States, they had to pay for another ticket at Ethiopia Airlines. Majority of the respondents said the hotel rate was between 15,000 naira and 18,000 naira 600 per hotel. Impact and experiences of the evacuees during quarantine. Majority's responses showed that feeding in the hotel was free, while 3 of the respondents said they paid between 1,200 naira to 3,600 naira per meal. These experiences add great financial cost to the evacuees. Also, majority of the respondents were of the opinion that COVID-19 quarantine have negative impact on travelers with respect to supplies of basic needs. Social trauma, economic. The implication of all this was that participants appear to have their human needs put on temporary hold upon arriving in Nigeria. Since they cannot go to their family, they cannot go to their respective houses, they have to stay in the facility in Abuja, whether you are from anywhere from the country. This is to reflect the fact that we are all operating and living within unusual time, a time that depends extraordinary response to such social isolation. Thus, the impact can never ignore some of the psychological, financial, and social impacts of the evacuees. Challenges of institutional quarantine during COVID-19 lockdown. The majority of the respondents will only identify NCDC as the agency managing the institutional quarantine because that's the one they see often. There was a diverse opinion on suitability, coordination, and sustainability. Some of the evacuees of the opinion services were suitable and they cannot be sustained. Majority indicated that the accommodation was adequate, but others said it was not. However, participants reported mixed feelings and responses on the adequacy of setting up isolation centers for suspected COVID-19 patients returning to Nigeria from the US. The inadequacies include the provision of hygiene, testing kits, sensitization programs on prevention of the COVID-19 virus, enforcement of social distancing, wearing face masks, treatment, and care of COVID-19 patients. Also, inadequacies related to coordination between travelers and managing institutions and agencies, and the effort that the government puts in place. Implications for practice and policy. About a year now, government seems to struggle to provide sufficient testing resources to the population and individual quarantined upon their return from the US. It is incumbent on the Nigerian government to ensure that testing centers are decentralized to accommodate more testing, and also to provide sufficient testing resources to community health centers to protect them from infections. Also, to give enough PPEs, protective equipment to health workers who provide medical services to Nigerians under quarantine to services without any fear of being infected by the virus. Government also give hygienic materials and provide psychoeducative techniques, social distancing, and avoidance of large crowd gathering. Also relating to participant result of mixed feelings on provision of hygienic environments, meaning that government has to provide sufficient clean materials for those quarantined and also the general populace. Therefore, healthcare officials also need to ensure that quarantined households have enough supplies for their basic needs. And importantly, the provision of these basic needs must be as rapidly as possible. That is to say that for those that are under quarantine, necessary household then promptly and adequate action plans established to ensure resources do not run out. So the government must have enough in stock that can go around without any fear of running out. These responsibilities could serve as a preventative approach as well as curative approach. Also, individuals.
Sorry, ma, you have 3 minutes.
3 minutes, okay.
Yes, ma'am.
Okay.
They all have your PowerPoint, and who does not have the request of it, and then you can go to recommendations and
okay.
That we have
the
a
conclusion. Okay. In conclusion, we concluded that COVID-19 pandemic has affected all the nations of the earth, and some people who traveled out of their countries of residence were also stranded in their host countries, like Nigerians that traveled to the US, they were stranded in the US and had to be evacuated back to Nigeria. Then the travelers bore other costs related to social isolation. Our recommendations are that all healthcare precautions should be institutionalized as compulsory for all travelers without compromise at any level. This is to ensure that the COVID-19 is not given a room to spread from travelers to others within the community. Another thing is to alleviate the challenges occasioned by the quarantine. The government can subsidize accommodation and hotel bills because some of them were not prepared for it. So it became extra cost on them. And also good food and balanced diet is also necessary to be given to them so that in the course of being under quarantine, they will not develop low immunity.
We seem to have lost you again, if you are hearing us, ma.
To be infected by. Can you hear me, sir?
Yes, ma'am.
Yes.
Go ahead.
Okay, moreover, it is suggested that to reduce the burden occasioned by the lockdown, travelers should be allowed to use the original return flight tickets at a later date with their respective airline operators instead of forfeiting it. The Nigerian government should also ensure that testing centers are decentralized and to also provide sufficient testing resources to community health centers. In addition, the government should provide sufficient clean materials for those quarantined and the general population. Above all, it is recommended that the Nigerian government should provide modern and well-equipped medical facilities around the country to address medical and social challenges arising from COVID-19 pandemic, and especially to ensure good provision of sound health care for persons infected with COVID-19 disease during isolation and quarantine in Nigeria. Thank you very much for your kind attention.
Thank you very much, Dr. Ademola, and thank you. You can stop sharing yours. You can stop sharing. You can stop sharing, man. Okay, good. We want to thank you for this brilliant presentation, despite the technical pitch along the way, which is kind of unavoidable anyway. Let me start by also commending you for a well-grounded methodology in approaching this ongoing pandemic. And we are so lucky that Professor Moniolua Olani is here. And when you were talking about nutrition and the health challenges, I was just thinking, no, we can do a special edition for the journal. And with the permission of Professor Emeritus Godwin Sogolo, I think Professor Olani can take this. It could be our second edition. We focus on pandemic from health perspective and politics and diplomacy. And we can discuss that. I know that I put people on the spot and my senior sister will forgive me. She's smiling so that before I forget it. So I think we can really tap into our experience. The methodology, in my opinion, is so informative. They have looked into a case study, the United States. And one of the things, and I will give the floor, I've posted that if you need to ask questions, please put it in the chat, I will know, or you raise your Emicon hand, or you raise your physical hand. If I did not call you, I'm so sorry. I can only see 1, 2, 3, 4. 4 times 4, that is what? Is that 16? Okay, I'll call Baba, will be the last to round off for us. But please, you will need to make your question and the comment so short. I see so many papers arising from these. I see international politics, diplomacy. What about evacuees from Saudi Arabia? Someone can do a paper about that. And that is why I begin to think about Professor Olani helping us out we begin to collect papers for peer review. You can see the women coming back from Saudi Arabia. We saw it on TV. You can see children. So there's so much to really, write about or research about, and that we can also benefit from this methodological approach by Dr. Ademola and Dr. E.G. The role of NITCOM is also important. In one of your respondents' qualitative survey, somebody said he got to know through NITCOM. What has been the role of Abike Dabiri and the Commission? It could be another, paper. Lastly, before I open the floor for others, please get in touch with me if you like to be on the NCDC, TED Fund, Dangote Foundation sponsored Nigerian COVID-19 Research Consortium. We have 10 working groups. I'm in the social science working group as a co-lead, but we have various working groups that I cannot share with you on this screen and because of time. So at this point, let me allow people to unmute because I cannot see hands with the exception of Professor Sogolo's hand. And then we have so many people, oh my God, so quite an appreciable number of attendants. But let me unmute, ask all to unmute, but please, if your background is so noisy, kindly just, So, Professor Olani, you want to go first? You have something to say? And I can call random.
Oh, no. I would like to commend the presentation of Dr. Adimula. And, as she was just starting her presentation, and I now said to myself, a major principle in disease control actually is quarantine. And we also look at many pests are actually migrated actively by hosts or by vectors. So you could be moving one organism from one location to the other. So in disease management, it's very important because these pests are moved actively by human beings or by several other carriers. I commend her presentation, and for me as a plant pathologist and particularly nematologist, is also an important principle. And as if you saw my heart when you put me on the spot, I cannot say no to you. So
thank you,
whatever we can do to support this vision, we are willing to. Thank you.
Thank you, ma'am. And for those joining us after my initial comment, the Vice Chancellor, Professor Femi Peters, sent his apologies. He was with us before. Even Baba Sogolo was the second person to join, and he was with us and sent his apology. He has to meet with the principal officers. Dr. Aneto.
Yes, sir.
Go ahead. You are a public health person, so I thought, and a fellow of the center. So I'm putting some people on the spot until I call Baba Sogolo.
I was not expecting this call. Well, I want to really thank the presenter for a job well done. And it's an interesting topic. Of course, anything on health, I find it very interesting. Well, the area she talked about, the recommendation of how government can help the people. And I was very touched when she talked about the quarantine support. Barely 4 weeks ago, I was quarantined 2 weeks. But luckily, it was in my house. However, when you have to go to the foreign land and they say, well, I'm quarantined in hotel, of course, it's very, very expensive. And so I think it would be a good thing if that kind of recommendation can be pushed forward through any means where it can really help, that people need to have a subsidized accommodation when they are quarantined. And of course, like she has rightly mentioned, no good food, no good health. Whether you are quarantined or you are in your homes, You have to try to eat foods rich in antioxidants. These antioxidants are common in our vegetables and fruits. If we can eat much of them so that we can boost our immunity, so that we attack the free radicals that these viruses put in us to make us sick. And this is one way to improve our health, both in the accommodation we are given or in our homes. We must try to boost our immunity and, of course, obey all the rules of the COVID rules so that we don't get
Thank you.
people. It is real, like we all know. I know so many that are close to me that God has helped to come out of it. So it is real, but with good nutrition and obeying the rules, we surely make it. Thank you.
Thank you very much. And it's also ideal to spend that 40,000 at either Medicare Star or somewhere, Medicaid Star, and just do your own check. It's really good. I do not see any other hand. Professor Emeritus Sobolo. Go ahead, sir. Let me unmute you. I think Professor Sobolo. And then after that, Dr. Ademola can respond. Ask to unmute. You can unmute now, sir. Unmute, sir.
Okay.
Yes, sir.
Are you hearing me?
Yes, sir.
All right. Thank you very much. First of all, I want to commend Dr. Ademola for a very interesting presentation. The topic itself is interesting. Indeed, anything you say about COVID-19 is bound to be interesting because it affects everybody. And many of us, particularly those of us who are, she talked about the chronological age, 50 and above, which is interesting to those who are 50 and above. But what about those of us who are over 70? It's particularly interesting. And so, you listen keenly with, for the whole presentation. That is what really makes the paper very interesting. It is interesting, but then there are problems. Any such topic, interesting as it may be, it begins to raise questions. What is the academic content of the presentation? It's good to talk about the experiences of people in quarantine, the hardship, the trauma they go through, and so forth. But then the question is, what is the theoretical import of the narrative?
Yes.
In other words, what is the academic component of the entire paper? That is the issue. I was looking and saying, okay, if you say there was this experience, this they went through, this went through, and so forth, inconveniences, interesting experience, and so forth. So the question is, so what? What are you putting together? What is the academic content of this? What is the theoretical conclusion, which would then lead us into saying that whenever people find themselves in these circumstances, this will follow. In social theory, or even in psychology, you want to have a generalization. And that is what scholarship is all about. And I believe that interesting as the presentation by Ademola is, she still has to do that work, try to bring it together and begin to draw some conclusions, which will say, all right, these are the theoretical aspects of this presentation. Otherwise, the presentation itself is very exciting. And that is why we can listen to it. In fact, if she wanted to go on for another 40 minutes will be interesting, because that's what is current. That's what people are going through. Every one of us is interested in this COVID-19. But the only problem there is not our problem, but anything that is current, you know, you find it difficult to get some academic content, whatever, because this is current experience, and scholars are still putting it together. So for now, it is an interesting paper, but then it is something to work on, so that at the end we begin to see that there's some, you know, some theoretical conclusion that we can draw out of it. Thank you very much.
Thank you very much, sir. We would listen to Dr. Kehinde Ijitono from College of Science and Technology, SRK. You posted something. If you are hearing me, can you unmute and speak to it? And after that, we listen to Dr. Shaibu. Let me see, Shaibu Makonjola. So in that order, and then we will allow Dr. Ademola to respond, and then we close the show for today. All right. I guess Dr. Ademola can speak, respond, make a comment, and then we can round off.
Okay, thank you very much. Thank you very much, sir, for the opportunity again for response. I want to appreciate the two earlier speakers. I think Dr. Alera and Neto. I have noted your comment that quarantine is a major disease control, especially in times like this, and also elaboration on that. And Dr. Aneto, I'm happy that you could share your experience with us. And definitely, as you have said, quarantine support during, a lot of support is required during quarantine. And I believe that the government will look into this. Thank God that came out hale and healthy. I want to also appreciate Professor Sogolo, our father. I thank you because you have also made some suggestions on how the paper can be improved, which I agree with absolutely. I've noted it, and I'm going to work on, myself and my colleague, we are going to work on theoretical framework and the sociological theory to situate this particular study academic terrain so that it can put into academic excellence on this. I thank you because I know that with these responses, this paper will be enhanced, and we can submit as soon as possible to the center, as Professor Ibukunle has said. Thank you very much once again for the opportunity.
Thank you very much, Dr. Ademola, on behalf of your co-presenter. There is one secret thing I usually tell colleagues when we go for NUC accreditation, and I'll tell them, we have come to look into your present, not your future. Whatever comment we are making is not that we are better than you, but please just say, noted, sir, noted, ma. Because some of the people on this team may not be as lenient, collegial as me. We write our individual. So if you still want to keep your program, notice and then you go back. I think there is a strong validity in what our Baba Professor Emeritus Sogolo admonished the presenters. And as he was saying that, I begin to remember, perhaps you may want to look into this anthropologist's everyday life. the concept of everyday life can be a central or a center point for other theories that will bring together the differentiated narratives. And of course, you gave us just one narrative about the United States, but differentiated narratives in perhaps a comparative analysis, looking at Saudi, looking at US, but also more importantly, the need to unclear the fussiness in definition of quarantine, isolation, and the self-quarantine, government control quarantine. You know, you have to be able to bring those out in your, perhaps in your introduction, and then you tie everything together. Again, we thank you so much for joining us today. We continue to pray for God's wisdom, and we will see you next week. Next week is going to be so important as this, because the former Vice Chancellor, immediate past Vice Chancellor, is the one that we are honoring. And the chief host will be our Vice Chancellor, Professor Pemi Peters. The host will be the VC. I believe the chief host is Professor Sogolo. I will talk to you all about it, and I will post. But again, be here. We have 5 panelists talking to us about social media discourses, you know, decolonizing Abdallah Uba Adamu. Okay, and of course we will benefit. We can even bring social media issues concerning this pandemic, fake news, real news, outbreak, in between. So I thank you so much, and I wish each and every one of you all the best. Adios, stay blessed, and I say bye-bye.
Bye-bye.
Bye-bye, thank you.
Bye.
We will share the recording as usual.
Bye.
And we edit. Thank you.